Yes, it's 2 o'clock, so now I can say welcome to this digital event with 2cureX. My name is Henrik Ekman. I'm an equity analyst here at HC Andersen Capital. And with me today from 2cureX is CEO and Fernando Andreu, co-founder and CSO Ole Tastrup, and CFO Kenneth Johansen. As always, the format is that the company will make their presentations and we will have a Q&A afterwards where the audience can forward questions that I will try and forward to the company. So with that, a very warm welcome to the three of you. It's been a lot of things going on in the latest quarter, so I will give the word to you, Fernando, and you can take us through the highlights of the quarter.
Perfect. Thank you very much, and thank you to those of you who are joining us this afternoon to look at the developments, the main developments of the Q4 at 2cureX. Next slide, please. First, as you know, we have to show the forward-looking statements. I think you're all familiar with them, so we will not go through them in detail. What we do, for those of you who are not that familiar with 2cureX, there might be some people in the audience who are new to 2cureX, just a few words about what we do and why we are doing it. So what we do at 2cureX is drug sensitivity testing in oncology. This means that we are looking at individual patients' tumors and how they respond to individual or to specific treatment options. And I will explain a little bit later why we are doing it, and then we will explain how we are doing it. But I think what's important here as an opening statement is we are convinced that this, matching the right treatment to the right patient, is going to transform oncology practice in the same way that genomics testing did 20 years ago. People think that genomic testing is a very new thing, but actually it's already 2 decades. And it has, over these 2 decades, completely transformed the way how oncology is practiced. We are convinced that drug sensitivity testing and through functional testing, as we are doing it, is going to be the next wave of change in oncology. In a nutshell, as a company, as I said, we are in the field of predicting individual response to drugs. And with this, we provide the information to the oncologist to define the best treatment course for individual patients. We do that based on proprietary technologies. It's important to highlight that these proprietary technologies and this know-how that we have is not only in the field of biology, but also in the field of data science. Our image analysis algorithms are something that we have developed ourselves and is crucial to the test that we are doing. We have 2 tests which are already out in the market. I will disclose a little bit later. And the third one that is coming very soon. These tests are being rolled out nowadays throughout Europe. We have additional tests under development. We have these tests clinically validated. We have CE marking. Our quality management system is, we have CE marking. We have a quality management system that is ISO 13485 as well. And we have 14 countries where IndiTreat is being promoted as we speak. This covers approximately a population of 235 million people in Europe. We are focused in colorectal cancer, but the same technology base can be applied to other solid tumors. And the reason why we are doing this is because it's all about having an efficient use of cancer drugs. If you look at the left side of this slide, you have here the cost dimension. Oncology and cancer is a huge burden to healthcare systems. Only in 2020, more than $200 billion were spent in cancer drugs. $18 billion, approximately 10% of that was spent in vitro diagnostic tests related to oncology. And there is an urgent need of keeping this cost under control. There is an urgent need for sustainability. But more important for patients, especially when we look at the right side of the slide, because the truth is that today, despite all these expenses, actually the outcome of patients has not improved dramatically. And furthermore, as you see in the pie chart, even if everybody talks about personalized oncology, 70% of the treatments actually are not personalized. 70% of the treatments are still one-size-fits-all approach, where patients are treated based on guidelines and they are treated with the same drugs. Only 30% or less than 30% of treatments are actually personalized through biomarkers. Even there, I have to say that 2/3 of those treatments which are personalized, actually, the patient will not see the expected benefit out of the drug, only 1/3 will. So, and that's the space that we call personalized oncology. So there is a lot to do here. Now, let me now move to Ole, because he's going to explain a little bit how we do it.
Okay, I will sneak in here. Thank you, Fernando. As said, we will try to walk you through the process, this industry technology base that are the fundament of all our products. What you see is actually the two products that we have sent out, namely IndiTreat MCRC test, start, and extend. So the first picture shows you the patient. We take a small tissue sample from the patient's metastasis. These patients have a disease that have spread in most cases to the liver. That's what you see here, a CT scan. The dark areas, that's from where we take the sample. From these areas, we can make replicas of the patient's tumors in the hundreds, even in the thousands, by small 3D copies. We call them tumoroids. We have characterized these with a number of academic and clinical partners and shown that they have a genetic signature and a functional signature that matches the patient. Then we challenge these small tumoroids with treatments, and very important treatments that are already in the marketplace. These treatments will show whether they can inhibit the growth of these microtumors or not. And the ones that can inhibit, those are then offered to the patient. So we have developed all these components from the tissue sample in the patient to the report to the oncologist. If we take the next slide, we are sort of trying to show you at a glance the history of 2cureX. We've actually been here for quite a while. Way back in 2006, we spun out 2cureX from Carlsberg, where some of the initial discoveries were made. We then have been at the biggest colorectal cancer surgery site in Copenhagen, namely University Hospital Bispebjerg. We were there for 10 years, and now we are at Symbion. The 4 streams you see there indicates the first one is sort of financials. Until 2017, we were privately held and financed, and in November of 17, we got listed at First North. We have then had a couple of capital raises since. What have happened during this period is that we have obtained a solid patent protection. As said, we have been here for a while, so actually our discoveries were very early, and our patents have been issued globally, which is very important for us to go out with our products. Then we also have had an organizational development. In the early days, we really focused on getting the technology right, getting it protected, finding the clinical partners. But here, especially in the last year, we have focused on getting a team that can actually commercialize the technology. The last stream is then the actual product development. What really triggered us to go into the market, that Fernando and Kenneth will come back to, was that we had a very positive clinical trial conducted. This was a 3-year trial that showed that we could really increase the effectiveness of already existing drugs in this very difficult group of patients to treat. That allowed us to expand the organization with a strong commercial arm, and that's what Fernando will come back to.
Yes, thank you. So basically, now we are moving from a little bit of background and history into what has happened in 2021 at 2cureX. And it has been a very, very intense year in terms of developments. We have expanded our portfolio. We launched the first two IndiTreat tests. One of them is IndiTreat Start, and this is for metastatic colorectal cancer patients facing first line of treatment. So we are providing the oncologists with the information required for the first line treatment. And then we have IndiTreat Extend, which is also metastatic colorectal cancer patients, but for the third line of treatment. So these two tests were launched in 2021. We published the results of this clinical trial that Ole was alluding to, and these results show that in a clinical practice, using IndiTreat to guide the therapy decisions actually more than doubled the progression-free survival, the percentage of patients which are in progression-free survival after 2 months of treatment. This is really important. Third-line patients, unfortunately, you don't see response in terms of the tumor getting smaller. The main goal is actually to stabilize the tumor, that it doesn't grow. So typically 20%, and when the treatment is guided with IndiTreat, it was proven to be up to 50% of the patients. When we started the year, we had distribution agreements covering 6 countries in Europe. We moved that, especially in the second half of the year, from 6 to 14 countries where we are present today. We achieved also in the second quarter of the year, we achieved the ISO 13485 certification. This is really crucial because when you're a diagnostic company and you want your products to be CE marked, you need to have a compliant QMS system, and ISO 13485 is the reference standard. So we are there. We build up a whole commercial operations team with business development and marketing, strong professionals, highly experienced, who know exactly what needs to be done to bring new technologies into the IVD space. This knowledge about diagnostics, IVD, is also very important because it was in the past not that present. So the fact that when I joined last year, that's also an event of 2021, and also Kenneth, both of us were coming from the IVD industry. So again, having a better knowledge of the environment that we would be facing from all perspectives. We started promoting the products through our distributor network and actually received the first commercial order in the last days of the year. It was a small order, more symbolic if you want, but really important for us as a proof of concept. We also brought together a new advisory board, clinical advisory board during 2021 with world global leaders in gastrointestinal cancers. They are guiding us in the development of our portfolio, in how to present our products, in how to design the clinical trials, etc. So really important for us. And finally, we launched, now that these two products are available and we have the distribution network in place, we launched what we call an early access program called Ignite. I will speak a little bit later about this, to give hospitals who are willing to try IndiTreat in their clinical routine practice, to give them a chance to access that. For 2022, we have defined we have disclosed actually 3 goals, 3 different areas. One area is the geographic rollout. And here, as I said, we are now at 14 countries. We want to expand that to up to 20 countries in Europe. The second one is related to number of hospitals using IndiTreat. This is a KPI related to the penetration potential of the test. We want to be at 30 hospitals at the end of 2022. And as I said, we have now 2 products in our portfolio. We want to add at least 1 more product. Here, I want to emphasize maybe having already two tests just launching a third one might not seem a very ambitious goal, but actually we have to remember that in May, there is a significant change in the regulatory status, in the regulatory environment of the diagnostic test in Europe. Therefore, launching tests after May 2022 is going to be more complex because the process is longer. So having 3 products in the portfolio at the end of the year is our goal. So to the first goal of being present in 20 countries, all I can say is, as I mentioned, we are already in these 14 countries that you see here in the picture, and we get very often the question, what happens with France, Germany, UK, which are among the largest countries in Europe. And what you see here in the orange indication is that basically these 3 countries have a centralized reimbursement scheme, as opposed to the other countries where there is no centralized reimbursement scheme, but it's more hospital to hospital or by regional authority that you negotiate the introduction of a new test. In these 3 countries, it's a centralized reimbursement scheme, so it's much longer, the process. So we are in the process now to prepare the dossiers, to submit the dossiers to get this reimbursement. But this is a long process. And this is why we are still not looking, or we have not looked in 2021 for distributors here, because it's difficult to get a good distributor when you have not started the process of reimbursement application. Now we are in a better position to discuss in these countries with potential distributors. The main task that distributors are doing now is promoting the IGNITE program. And this IGNITE program, basically, it's, as I said, it's designed to give hospitals the chance to test IndiTreat in real life. It's a program where we are sharing the cost of this testing with our distributors. So it's a joint effort with the distributors. And we, as I mentioned before, we are looking at having 30 hospitals using IndiTreat at the end of the year. What you see here is how we are rolling this out in our plan over the 4 quarters. So we were planning that in first quarter we would have 5 hospitals enrolled. In the second quarter we would have 7. Third quarter we would have 8, of course, additional. And then in the fourth quarter we would add 10 more for a total of 30. We are glad to say that as of today we have already 4 hospitals who have enrolled in the program. Therefore, our goal of getting 5 in first quarter seems to be well in track. And then we have, in terms of product portfolio, again, we have here what the first 2 tests, IndiTreat Start, IndiTreat Extend, and we can announce now that in this month of March that we are starting today, we will be launching the new IndiTreat mCRC Explore. This is also for metastatic colorectal cancer patients and looking at drugs that are approved for other cancer indications, not for metastatic colorectal cancer. We also have our IndiTreat specimen collection set, which is the box that contains all the elements that are required to preserve the sample when the sample is shipped to our facilities in Copenhagen. And then just a very, very quick word to the fact that we have changed the IndiTreat image also in this last quarter of the year. We launched a new logo that you can see here. And also we changed our communication strategy in the sense that we are going to be focusing our communication with healthcare professionals and distributors. We are going to be giving emphasis on the IndiTreat brand, while for the markets and for other stakeholders, we will continue to emphasize the 2cureX brand. This new logo is now implemented in all our printed materials, and we are going to have in the coming weeks a renewed website and the presence in digital media using this new image. So with this, this is a summary of what has happened in 2021 and specifically in the fourth quarter. And now I think it's the moment for some financial highlights from Kenneth.
Yes. Should we shift, please? you can stand on my spot. So hello, and good to see you here virtually. So I'll give you a quick update on the highlights for 2021 and the Q4. As some of you might have seen and know, it was released to the markets last week on the 24th of February. The highlights in it, I've addressed on this slide, that what you see from the outcome of 2021 is that we have a cash position of approximately 73 million Swedish kronor, with a good equity ratio of 93%. Also, given what you saw earlier in the presentation from the amount of equity increases that we have had in the history of 2cureX. The result per share was a minus of 1.1 Swedish kronor, which I'll come to a little bit below. And the operating expenses, the operating income was 7.4 in 2021, whereas the operating expenses and our investments into the business was approximately 30 million Swedish kronor. We had a net cash flow of 14.1 million Swedish kronor in a surplus, which again comes from the capital increase that we've seen in 2021. So we go out of 2021 and into 2022 with what we consider quite a strong foothold in terms of being cash sufficient for the operations and for the plans that we have put into place. Just a graphical overview of the last 4 years for 2cureX. So what you see, again, there's a reference to the interim report, which you can find online on our website, that the equity and our cash have seen an increase during the last 4 years, which has been a good foundation for the future activities that we will see close to. And just a quick overview, if we look at it from a quarterly perspective, this is our focus here. We always focusing on the business on as short terms as we can. So the Q4 in development here, that we had a profit, a loss in Q4 for 6.2 million Swedish kronor, but in Q4 as well, a surplus of the net cash flow coming from a various amount of payouts from tax incentives and finalization of some grants, which are included in what we call operating income. But I encourage you to look at the financial report that we share online. If you have not done so already, that includes more details into the financials of Q4 and also for 2021. It also incorporates some of the highlights from the year and the quarter as a whole. And there will be a release of the actual consolidated numbers in the annual report by beginning of May, on the 3rd of May, which you can all see in our financial calendar online. But with this, there was a quick glance for the financials. So of course we take questions later on if you want to. That was a quick run through of this.
Yeah, and then just as a closing word for our presentation before we move to the Q&A session. What happens beyond 2022? What are the potentials for growth of our business? We organize our future expansion planning around 3 dimensions. One dimension is the geographic one. As I mentioned before, we are now restricted to Europe, basically because we have everything being done in our Copenhagen lab. We have to get the samples here within 24 hours. But of course, we can expand beyond Europe, especially by setting up testing hubs in the different regions. So we are constantly assessing our options to open such hubs in Middle East, in Asia, or in America. But geographic expansion is one dimension. The other dimension is our portfolio expansion. I have alluded, and you have seen that we have a full portfolio in metastatic colorectal cancer. There is still room in the patient process. There is still room for 1 or 2 more tests within the space of colorectal cancer. But also there are commercial synergies if our next test outside of colorectal cancer remains within the area of gastrointestinal cancer. Therefore, we have an advanced program in pancreatic cancer as well, where our feasibility studies are almost finished and we could transition to product development soon. And then, of course, we can expand beyond gastrointestinal cancers. We also have an advanced program in ovarian cancer and other solid tumors. So that's the second dimension. And the third dimension, how we can grow, is by, sorry for the word, productization, which means that today we are our business model is basically a central lab where the samples are received, samples are tested, and then sent back the results. But actually, we are looking, and we have a program to automate part of our process. What we are looking at is the possibility of putting our technology, our process, our workflow in a box that could be placed at the hospital site. Therefore, allowing the hospitals to run the test by themselves, and then obviously changing our model into selling instruments, reagents, and software services around this. So these are the three dimensions where we think beyond 2022, the company has a big possibility of growing. As a summary, 4 bullet points. First one, four takeaway messages. One, there is an urgent need to improve the way how drugs are used in oncology today. The current model is not sustainable. The second one is that drug sensitivity prior to therapy is giving the oncologists the information they need to tailor and to match properly patient and treatment. The third one is because of our history, because of our team, because of our technology, 2cureX is best positioned to lead this space globally, this new space of drug sensitivity testing. And the fourth one is that we have a solid financial position, as Kenneth said, to fulfill our goals until break-even, and multiple pathways for long-term sustained growth. With this summary, I think we can move to the Q&A. I hope we didn't go too long.
Thank you very much, Fernando. Yes, time is running, but I'm sure we can take a couple of questions. So let me kick off with a question relating to you're mentioning this milestone that you received the first order, but still it wasn't translated into revenue. And I guess generally, I think many investors are wondering how the rollout with these distribution agreements, how they translate and how and when they translate into revenue. I know there are this Ignite program that gives away the test for free for a short period of time, and so can you elaborate a little bit on how should the rollout and the orders translate into revenue and when?
Yes, so it's a process from the moment we sign a contract with a distributor to the moment where we would get an order from a hospital. It's a process, and of course we try to keep it as short as possible, but it has to go through several steps. The first step is when we sign a distributor, then we have to train the sales team in this distributor, and we have to provide them with translated materials in their local languages that they can use with their doctors, and then we make the first visits together with them. So that's the first step, talking to the oncologist in the different countries, introducing them to IndiTreat, and getting their attention, getting their interest, and their willingness to try. Then the Ignite program kicks in, where even if the oncologist is willing to try, of course there are certain administrative processes inside the hospital that need to be fulfilled, so that they can start sending samples to us. So that's the second thing. And then after the Ignite program or the Ignite period, let's say, is finished, then not waiting for the end, but more or less in parallel, we have to start the economic negotiations with the hospitals. Each hospital has a different process in the way how they purchase this test. Some of them might need to issue a public tender. Some of them might be able to buy directly. We have to initiate these economic and administrative discussions with the hospitals so that then they can start placing the orders. I got the question recently, and how long do we think the Ignite or the transition from the Ignite period to a purchasing agreement would be? And I think in our planning, in our modeling, we are looking at least in the range of 3 months between the free of charge period into the converting a hospital into a paying customer.
Relating to the commercial rollout
Sorry,
plan.
I just want to emphasize one thing because it's important. The Ignite program is co-sponsored together with our distributors. So even from the Ignite program, we are expecting to see some revenue coming from our distributors.
Relating to the commercial rollout plan, your current reach is 14 countries representing 35% of US citizens. The goal is to go to 20 countries, and how far will you take then the coverage then from the 35%? It's just to get an idea of how much you will cover with this.
Yes, I am smiling because actually I wanted to include that in one of the slides, and then I was told by our advisors that this is not a goal that we have disclosed, and therefore I should not include this in a slide before we have disclosed it publicly. So unfortunately, I mean, I know exactly the number, but I cannot say it now because I had to delete it from the slides.
Okay.
We will probably issue soon some kind of announcement of some additional goals to the ones that we have already disclosed. These three numbers that we disclosed: number of countries, number of hospitals, and number of products in the pipeline. And we will certainly include that one about the coverage, because then, yeah, people can more or less project what to expect.
That sounds good. There's a question from the audience, and as we move on to discussing your product line, who are your biggest competitors?
Okay, so we have a number of companies who are actually doing cell culture based tests and looking at the effect of drugs in these cell cultures. But actually, most of them are dedicated to the drug discovery phase. So they are not applying this technology to existing drugs and real patients in clinical settings, but more they are applying this technology to validating new targets, new markers that pharma companies might be looking at. And the reason for this is obviously that's a much easier market from the perspective of regulatory implications, et cetera, because that's not a regulated market, while the diagnostic market is a regulated market. In the regulated market, we think, and we are sure because we monitor very closely, that we are ahead of anybody else when it comes to our territory distribution, when it comes to the regulatory status of our test, and when it comes to the clinical evidence that we have. But I don't want to be accused of escaping the question. Therefore, if I have to name two companies, I would name a US company called S-Engine, and I would name a French company called Oncomedics. I think these two are, let's say, also looking at the clinical market, but certainly they are way behind where we are in terms of bringing this test really to clinical practice. Okay.
Going back to your product family of the IndiTreat, Start, Extend, and Explore, is that the way we should look at it across different cancer types, or how should we interpret this way, of this structure of tests? And also, do these clinics need to buy all of them, or how should we understand this?
So I think that's a very relevant question. What we are doing is we are developing specific tests which are looking at the drug sensitivity profile in specific decision-making points that the oncologist and the patient are facing. So And there are several points throughout the life of a patient where a drug decision has to be made. And it is sometimes before surgery, sometimes after surgery, and then when the metastatic phase kicks in successive rounds of treatments. And the reason why we are doing it like this is actually to provide to the oncologist the information that is relevant in every moment, and only that information. This means, to your question, that actually what we expect to see is that an oncologist can use the different IndiTreat tests throughout the patient lifetime, 3, 4, 5 different tests, 3 or 4, 5 different tests in different times of the patient journey. And then, yes, this is how you should think of for each and every cancer entity. So when I spoke about the pancreatic cancer, we already have at least 2 or 3 different ideas of different tests that could be positioned in the pancreatic space, and the same applies to others. So it's really important that these tests are tailored for clinical decision making, and therefore they have to be very, very specific. And also in the way how we develop, validate the tests, etc., we do it with a very narrow focus.
Okay, and then there is another question from the audience. It's asked, why do you think there's such a lack of interest from investors to invest in 2cureX right now? And I know it's difficult to comment on the stock and the share price and things like that, but it's just that if you have any comments on what you see when you talk to potential investors. And
yes, it is difficult to comment on share prices because there are many components to it. What I can say is all our conversations with our major existing shareholders are always very positive in terms of commitment, of understanding of where we are going as a company, of understanding of the path forward. That this is a company that actually is creating a new space within the diagnostics industry, and that we are set to own this space, and therefore this is of very, very high potential. So from this perspective, I think regardless of the fluctuations of share prices, which might have other explanations and are always more short-term related, so to speak. In the long run, we feel very comfortable with what we are doing. We feel very comfortable with our plans, and we feel that we are communicating it properly to our shareholders.
Okay, and then there is this. Then there is a question perhaps relating to your financial guidance. You expect to generate stable cash flows.
Okay, I just had an additional comment to the last question, if I may. This about the investor interest. I think one thing that we have struggled with is to position us. I mean, that's where Fernando is saying we are actually covering sort of a new space. A lot of investors have felt that we are a drug discovery company, and we are really struggled with telling them, no, we are not. We are actually using the drugs that already are in the market in a more intelligent way. So that's the one thing, is they need to understand exactly where we are. The other is that they need to understand the risk reward. There's no doubt that we have a lower risk than a drug discovery company. But I think people will realize that the reward of helping patients that with existing drugs are overwhelmingly big. But it's just, it has been a little bit difficult to explain it. I think we have been better at it, and I also see more understanding, but there's no doubt that has been a little bit of a struggle because we didn't fit in to any of the standard boxes.
Okay, as said, time is running, so with that, I think we can say a very warm thanks to Fernando Adrer CSO Ole Tastrup, and CFO Kenneth Johansen. Thank you so much for participating in this event.
Thanks for having us.
Thank you.
Bye-bye.
Thank you.